And start recording. So our first one we're going to be talking about is home health care. So when we talk about home health care, the day students actually get to go to home health care. You guys are going to do your hospice in the hospice houses. These are your objectives. So we want to go over the governmental resources, the factors that have influenced the changes in healthcare. So meaning, why are we sending patients home quicker than maybe we used to? Identify the types of services that we can use in home health care, the eligibility requirements, and the members of the team. So when we talk about the different parts of healthcare, we have Part A, B, D, medical, and there's many others. My sister always likes to remind me she's an insurance agent, so she always tells me about everything else that's available. Oh, why isn't it coming up? So who here does home health or any sort of insurance stuff or work with any of that stuff? So what does Part A do?
It's free.
Part A is free. What does it do, though?
Covers skilled nursing facilities, hospitals, home health care.
Do you have that pulled up over there? Right. So the Part A covers your home health care, the nursing facilities, all that stuff. What does Part B do?
Is it outpatient?
Outpatient's more, or Part B is more your outpatient, your preventative services, stuff like that. Part D is
Medication.
drugs, right? So that's your drugs. And then what's Medicaid?
State funded.
It's state funded. So do you have to be 65 and older to have
Low income.
Medicaid?
Low income
Low income or disability?
or children.
There are certain programs for children, right? But they also have to fit into they have to be eligible through income requirements. So your Medicare, 65 and older, those are your elderly patients. Medicaid, and a lot of them will have both, but that's more your state funded health care. So what do you think changes? Remember back in some of you will remember back in the 80s, let's say back, but a while ago. So it used to be that you got sick, you went to the hospital, you stayed there until you were 100% better, and right, you became friends with all the nurses. And why do you think that they get out of the hospital so much quicker now when we try and get them home with home health care to a skilled nursing facility?
Money.
It's all about the money, right? So basically the Humana and Aetna and all of the healthcare, insurances say, over the last 50 years or however long they've been around, we've noticed that our top hospitals can get these patients out in such and such amount of days. So let's say you go in and you have CHF. Aetna says, all right, CHF, let me go through my book. So the patient will have, they should be out in 3 days, and it should cost $7,000 a day or whatever it is, right? So they have these preconceived amounts, and that's what they pay the hospitals now. They say, we're only going to give you $7,000 a day for this patient because that's what it shows it should be. So the hospitals aren't as apt to try and keep the patients there anymore, because it used to be like they just got to bill for every day they were there, and it didn't matter how long they were there, right? So now the insurances have stepped in and said, no, we're not playing that game anymore. So there's that. What else do you think has played a part?
The growth in population, maybe. People living longer, sick.
People are definitely living longer, right? So, but we're all kind of savvy now, right? We can look on the computer. You can get on the computer and you can start Googling, and you can find out which hospital is going to charge you what for what. Your doctors, your insurance says if you go here, it's cheaper. If you go there, it's cheaper. So we've just become much more savvy in navigating, where to go, how much to pay. So they've found out that we can do a lot of it from home now. So the machines that used to be this big and you can only do them in the hospital, now we have little teeny tiny ones that we can send them home with, right? So that also has shifted to more home care. patients can go home earlier if we have the accessibility to get those machines to send them home with. We now, instead of keeping someone, unless they're an IV drug abuser, we don't keep people in the hospital just because they need to be on antibiotics for 6 months, right? Give them a PICC line, we send them home, we send out home health care, and we say, here, this is how you do this, now here's your bags for the rest of the week. As long as they're able to do it, or someone in the house is able to do it, we let them do it themselves. If they're not, then a nurse will come in and do it for them. But the fact that we can send people home and do this stuff, it's a heck of a lot cheaper for the insurance companies than keeping them at the hospital. So of course the insurance companies want them home.
Insurance companies have.
And patients have gotten smart, right? It used to be, and it still is. My grandmother, bless her heart, but if the doctor says it, it's true, and it doesn't matter what it is. And if he says I need to stay here for 3 more days, then that's where I'm going to be. And we're better at saying, hey, I don't think I need to be here anymore. I can go home. I have this person at home that can help me. I have these resources. You know, I think we're just a lot more savvy with knowing that if we stay in the hospital, we're going to get infections or something's going to happen. Like, we don't want to be there as much as they don't want us there. So as far as home health care goes, the big, did anybody say they worked home health care? You have before? So the big thing with home health care is your patient has to require the skill of an RN. So that's the big, if anybody ever said, what is your number 1 qualification for home health care? They have to require the skill of an RN. We can't just send them home with home health care because they need someone to come in and change their pants, right? Or, so it has to be driven by some sort of disease, acute disease, because we don't do chronic diseases unless they need some sort of teaching. So it could be that your patient has a new ostomy, has a new Foley, some sort of complicated condition. Usually, wound care, it's going to depend on the patient and what kind of wound it is and where it is and if they're capable. I know my sister had like Chiari disease, so she had to go home on Vanco for, I don't know, 4 weeks or something. And they literally, the first day, just dropped off a bunch of bags of Vanco, put them in her refrigerator vegetable drawer, and was like, there's your stuff, we'll be back in a week to change your PICC line dressing and give you more. So, obviously there was teaching that went along with it. They didn't just say, figure it out, you know. But so any sort of teaching that you have to do with your patient. So let's say it's a patient that has brand new diabetes and we need someone to be able to go in and help them out with navigating finger blood sticks and insulin. We can get home health care for that.